Good afternoon, everyone, and kiitos for your patience. I had a hard time finding the right building. So I'm Dr. Katriina Hopper. I'm a geriatric medicine physician, and I work at Surya Hospital. And my specialty is in geriatric medicine, which is the specialty that specializes in the study of aging and care for older adults. And as you can see by the spelling of my first name, I do have some Finnish ancestry and connections. So I'm very happy to be here at the Finnish Rest Home. So today, the goal of today's talk is to understand a little bit about the science of aging and learn about what happens to our bodies as we age. And then I'd like to talk about healthy aging and how we can maintain our strength and our resilience as we age, and learn more about frailty and what that is and how it can be prevented. And if anybody has questions or if you can't hear me, please let me know, and I'm happy to speak up or to answer questions. So what is aging? Aging is the time-related deterioration of physical function that's necessary for survival. So it kind of goes into the very nature of time and space. It's actually related to physics. So in physics, we learn about entropy, which is the disorder and randomness in a system. And the second law of thermodynamics says that the entropy, or the disorder of the universe, will increase over time. And the same thing happens to our bodies, unfortunately. So this is just a little cartoon that shows anybody who has children knows that it's so hard to keep their rooms clean. And this little boy is telling his mom, "I blame entropy." So it's just that disorder that just tends to happen, and we always work against it. So our body cells work really hard to maintain order. So they're like that mom working hard to maintain order in the household. And we call that order homeostasis. And our cells, every cell in our body works to maintain a stable and relatively constant internal environment. And so it's a constant balance, and there's a lot of work that goes into that. We're always fighting against entropy. So what are those destabilizing forces in our body? Well, you've probably heard about free radicals. So those are those unstable oxygen molecules that can damage cells, and they're linked to aging and many diseases. And if you watch commercials on television, you'll always hear about some new supplement that works against free radicals. And we'll talk more about that later. But they're naturally made in the body, and it's just a byproduct of normal metabolism. And so they also increase with exposure to environmental toxins, so like cigarette smoke, pollution, wildfire smoke, industrial solvents, and then UV radiation from the sun. It can be neutralized with antioxidants, and these are naturally produced by our bodies, and they are found in our diet as well. The other thing that leads to destabilization of our cells is programmed cell death. So our cells can kind of turn off and can actually die if they have too many errors, because we don't want abnormal cells to proliferate, because that can lead to diseases like cancer. So many of our cells are sort of programmed to die, basically, and that gets deregulated in aging, and that can lead to high cell turnover or low cell turnover. And you may have heard about the telomeres, which are the very ends of DNA. Those have a protective function, and we know that shorter telomeres are associated with aging. And there's some research that things like exercise, like the things that we'll talk about later in this talk, can actually lengthen those telomeres and be protective against the effects of aging. And then, of course, environmental stress, and that includes chronic psychological stress as well. And then genetic factors. So you probably all have known somebody who has longevity that tends to run in the family. There are some unknown genetic factors that we're still learning about. So what happens when we age? Well, our cells lose their ability to perform the necessary functions. So they lose their ability to divide, to convert energy from glucose and the foods that we eat, and to transport molecules and ions across cell membranes, and that can lead to cell death throughout our body. And so as we age, in general, our body organs will shrink or atrophy, and the functioning cells can decrease. So I'm just going to go through the different systems just to talk about what happens as we age. So as we age, and we probably anyone who's over 40 will notice this, or maybe even over 30, that our bone density decreases and our cartilage decreases. So what does that mean as we age? We're more susceptible to the effects of osteoarthritis. So our joints may ache, especially the larger joints like the knees, the back, that has to counteract gravity for many years. And muscle mass starts to decrease starting at age 30. But the good news is that only 10 to 15% is attributed to age alone. So there's still a lot that we can do to maintain our muscle mass and to maintain our strength as we age. And how about sensory changes? So we all notice this. So in our mid-40s, we lose our near vision. And so we may need to have bifocals or have our prescription changed. We also have a need for more light. And so at age 60, a 6-year-old needs 3 times more light to read than a 20-year-old. So you may notice that when you're at home, if you're doing sewing or close work or crossword puzzle, you do have to turn on that little table lamp to kind of get a better look at what you're doing. And that's okay, because that's just a natural thing that occurs with age. We also have change in color perception, so colors may look less bright. Contrasts are more difficult to see. So if you notice, blue letters on a white background may be difficult to read, like it is up there, and then black letters on a blue background are especially challenging. So when people are designing road signs, for example, it's really important for them to use high contrast to really help that visibility. It's also something to think about if you're walking along the road at night, knowing that there are a lot of aging drivers. Make sure you wear something really bright so that they can see you, preferably something bright yellow. You want that contrast with the dark. So we all have heard about age-related hearing loss, and that it's very interesting because actually hearing high-pitched sounds becomes more difficult. And so you may notice that it is harder to hear children's voices or the voices of women like myself, but lower-pitched sounds are easier. Consonants are very high-pitched, so words can become harder to understand. So, you know, if, for example, you know, if somebody is saying, tell me what you want to keep, let's say you're cleaning your house with your daughter or with your mother, she may hear L-E-O-U-A-O-E because they're not able to hear those consonants because they're very high-pitched. We also develop a difficulty with auditory processing or filtering out background noise. So people may notice that when you're in a crowded lunchroom or in a dining room or in a party, it gets very difficult to hear what other people are saying and pay attention to conversations, and sometimes that can lead to some social isolation. So it's really important to have your hearing assessed as you age because amplifiers or hearing aids can help combat this as well. And people get really good at reading lips. So, and you may notice when we had to wear masks with the COVID-19 pandemic, it was very difficult to communicate, especially with my older patients. And once we were able to remove the masks, it became much easier. We become very good lip readers as we lose our hearing and aren't even aware of it. So that's just your brain is able to compensate for these changes, which is a good thing. So other sensory changes, so between the age of 40 and 50, the ability to taste and smell starts to gradually diminish. So it affects tasting sweet and salt more than bitter and sour. And I hear this a lot from people as they're aging. They'll say, well, the food just doesn't taste as good as it once did. Sometimes that is, related to medications that can cause dry mouth. But in general, we tend to prefer more highly sweet foods or highly salty foods because our sense of taste does become somewhat diminished. So it's something to keep in mind. So we lose, and it's interesting, in women that tends to happen in their 40s, whereas in men it happens in their 50s. Skin changes, I think we're all very sensitive to the changes that happen with skin, especially women maybe. So the skin becomes thinner, less elastic, and drier, and that can lead to fine wrinkles. And that's a loss of collagen and elastin and a loss of flexibility. But the other thing that happens is that the fat layer under the skin thins as well. And the ability to regulate temperature also is affected by this. And so as people age, you may notice that the thermostat is set a little bit higher, and often that is because the skin loses its thermoregulatory capacity. There's less protection against UV radiation because we have fewer pigment-producing cells, and then the hair follicles produce less color with age, and so that can lead to whitening or graying of the hair. Now, how about the brain and nervous system? So this is the thing that everyone worries about. So often when they come to see me at the Algoma Geriatric Clinic, they're concerned about memory or cognition. And so there are some normal things that happen with aging. So the number of brain cells does decrease with age, but we can compensate for the loss because our brains are built of connections between different parts of the brain. So it isn't just the amount of brain cells that we have, it's how we use them and how they're connected together. So new connections can be made, new cells can form, it just takes a bit longer, and there is redundancy and reserve. As we age, blood flow to the brain decreases, especially for people who have disease of the blood vessels, vascular disease. And after age 70, there is a subtle reduction in vocabulary, in short-term memory, and the ability to recall words. But this does not affect the ability to function independently with normal aging. So a little bit more about memory and aging. I'm going to go into the weeds a little bit about there are different types of memory. So when people talk about, oh, I'm losing my memory, often they're talking about their what we call episodic memory or short-term memory. And that's kind of information about recent past events or experiences, like where you parked your car or what you had for breakfast. We also refer to working memory as, that's kind of your mental chalkboard or whiteboard, and it allows you to recall bits of information like a phone number for short periods of time. So often when people come to see me, they're starting to have difficulty with their episodic or their working memory. That relies on specific structures in the brain called the hippocampus and the temporal lobes, and those structures can be affected by diseases like Alzheimer's disease. Semantic memory is kind of that general knowledge of facts. So it's kind of the history that we've accumulated over time. So how and when to plant a garden, how a car engine works. And then, of course, remote and long-term memory are events that occurred in the distant past. And now with semantic and remote memory are located throughout different parts of the brain. So it's kind of a distributed network. It's not just in one part of the brain, so that if you do have damage to your brain from a stroke or from a disease like Alzheimer's disease, you still have memory stored, these long-term memory stored in other parts of the brain, and so there is a resilience there. So what do we know about memory and aging? Well, that semantic memory, so that general world knowledge and history, and remote memory remains largely intact, or it even improves with age, which is a very good thing. We don't often think of things improving with age, although our episodic memory does decline. So that memory of, where you parked the car, what you had for breakfast, sometimes, what you did, details of what you did yesterday, those can decline. And like I said earlier, the episodic and working memory are further susceptible to the effects of neurodegenerative diseases like Alzheimer's disease. I often think of semantic and remote memory almost like the knowledge that you need to plant a garden. So if you've noticed, or I've noticed, that the best gardeners are often older adults. And if you think about it, you gain that knowledge. It accumulates over time. And so older gardeners know when to plant certain plants, where to find the best plants, how to do this, and it's something that you learn from every season, something that younger people just can't do. And it's often something that you often can't read in a book because only you know the microclimate of your yard and the community that you live in. So I think of gardening as a prime example of the strength of semantic and long-term memory in older adults. So what are the benefits of aging? Well, there are benefits of aging, and I hope that you leave this with feeling more positive about aging and the resilience that can happen with aging. There are studies that show that there is a greater acceptance of self and of others. There's a decreased fight or flight response, so that ability to generate anxiety tends to decrease. There's a resilience of the survival effects. So if you have made it to live into your golden years, you have been making good choices, or you've been very lucky, or there's a resilience that comes with that. Along with that is improved emotional and social intelligence, and often it's over that trial and error that we have of learning and gaining that semantic knowledge over time. And then experience brings perspective, and we call that wisdom. So there's this quote this is a Spanish philosopher, George Santayana, that those who cannot remember the past are condemned to repeat it. And so humanity really relies on the knowledge of our elders to help us and to prevent us from making the mistakes of the past. So let's talk about healthy aging. So I like this slide because it says aging is not a disease, it is an opportunity. And we do like to move away from this sort of disease model of aging, because aging is something very natural. It happens to us all. It's part of one of the laws that guides our universe. So I will talk about these aspects of healthy aging. Really, healthy aging is doing all those things that your parents and your teachers have told you about from a very young age, and that is exercising, sleep well, stay social, stay active, and eat healthy. All those things that seem so simple but can be so difficult to do in practice. So what do we know about staying active? So physical activity and exercise is probably, if there is a fountain of youth, it is exercise. And that's truly it. So regular exercise can decrease aging on a cellular and a DNA level. There are a lot of studies that support this, and the goal is to have 150 minutes of activity a week. And so the activity does not have to be high intensity workouts. It can simply be walking, yard work, playing pickleball. It builds endurance, anything that builds endurance and improves cardiovascular health. Strength training is also really important because it helps make everyday activities feel easier. So as we age, we're not just fighting to exist in our communities and climb mountains and hike hikes. Sometimes it's a struggle just to stay in our own apartment or just to stay in our own space and live independently. And the strength training can help you do that and helps prevent falls. Flexibility and balance training is also important. It helps prevent falls, helps maintain independence. So people can live with independence despite these normal physiologic changes. And I just included some pictures of older adults that we know who are celebrities, and just examples of people who are still making music, creating art, teaching younger generations, and are still a very important part of our society, as you all are. So staying active, so this is just another little slide that shows that endurance exercises, that aerobic exercise is important to improve the health of your heart and lungs. And anything that improves the health of your heart improves the health of your brain. Flexibility makes everyday activities easier. You want to use balance and strength. So it's not just, just taking a walk. If you have to do any exercise, just take a walk if you can, but try to incorporate strength training and flexibility and balance exercises as well. So for people who have difficulty with mobility, chair exercises can also be very helpful. And I just included some examples of different chair exercises that can be done. And then it's important to stay social. So, one real lovely benefit of living in a retirement home setting or living in a complex like the Finnish Rest Home is that you are with people. And we know that socialization is really key to maintaining our health as we age. It's key to maintaining our health at any age, but especially as we age and we're not able to leave our homes as much. We're not as mobile. A lot of us aren't able to drive anymore. We're kind of limited to the space that we're in. Being social improves mental health, gives a sense of purpose, provides cognitive and mental stimulation, and can promote healthy behaviors. So group exercise classes, for example. And then in terms of eating, we're very social creatures. So if you notice when you're in a restaurant, you tend to eat everything on your plate. And it isn't just because the food tastes good. It's because you're in a social setting. And so just the act of being social stimulates the appetite. So often when people move from their apartments, I see if they've been living alone and if they move into a retirement home setting, they'll often gain a few pounds, which is good. Just like when in college, when people move from home to the dorms in college, they would call it the freshman 15. It's kind of similar when you move to a retirement home. And that's okay. So ways that you can stay social locally are with the senior center. Doing volunteer work is really great. Enrichment and adult learning classes, social or hobby-based club. It's harder to find clubs nowadays. I think in previous generations there were Elks clubs. There were a lot of social clubs that everybody belonged to, but now we don't do that as much. Everybody's online on their phones, but we really do better when we socialize in person and when we're around other people than when we're online. So I hope that we move toward in-person activities. So music and arts organizations, churches and religious organizations, or then from a medical perspective, so recreation therapy and people who have a loved one living with dementia or who are living with dementia, the Alzheimer's Society or other organizations like that can be really key at bringing people together to socialize together who have similar health challenges. It's really helpful just to people watch. So going to the mall is a social activity. It will help you, just to have lunch in the food court with some friends or have coffee at Tim Hortons is a very good, very healthy thing. And then for younger people, if you have a lot of mobility issues and can't meet in person, online networking and video games. So as my generation ages, I'm sure we'll all be on our own video game server socializing together and in person. So eating healthy. So the research shows that the Mediterranean diet, which is rich in fruits, vegetables, nuts, and fish, is associated with decreased risk of dementia and cardiovascular disease. So the key to the Mediterranean diet is really not just eating the foods found in the Mediterranean, but it's limiting processed foods. And having more fresh vegetables and fresh fruits. So try to limit refined carbohydrates like candy, white bread, processed foods like chips and other snack foods like that. Limiting alcohol and avoiding soda is important. And drink water, making sure that you get enough fluids. The key is balance is key. And it's important to avoid fad diets. So every now and then there's a fad diet that goes around. So I think it was intermittent fasting or restricting to one food groups. There's always some sort of diet. But balance is really the key. And when you're an older adult, it's important to avoid calorie restriction because you need those calories. And intermittent fasting could potentially be very harmful because blood sugar, it affects blood sugar regulation. It may affect other medications that you're on. So balance is key and make your calories count. So when you are eating something, just it's important to make sure that has nutritional value. But it's okay to still have sweets and snacks now and then if you like them. You don't have to completely restrict those. So sleep well. This is a tough one. Really, the evidence shows that there's no medication that will give you a good night's sleep. So every medication will disrupt your sleep architecture. And that the key to sleeping well is really establishing a routine. You almost have to train your brain to settle down at night. So following a regular sleep cycle and developing a relaxing bedtime routine is key. I think we're all in our modern society are disrupted because we'll watch television or we'll use our mobile phone before we go to bed, and that can just trigger anxiety or affect our attention and lead to more activation of the brain. Try to avoid late afternoon or evening naps because they will disrupt your sleep at night. But if you have severe daytime sleepiness or restless legs at night, talk to your doctor because there could be a medical problem that is impacting your sleep. It's really important to avoid over-the-counter sleep aids that contain anything with PM in the title. So Gravol, Nitol, Tylenol, PM, all have a medication that is highly anticholinergic, meaning that it depletes your brain of a chemical involved in memory formation. And so it can actually cause you to lose your memory. It can also promote falls as well. The safest over-the-counter sleep aid is probably melatonin. So if you have to take something, I would recommend starting with that and definitely talk to your doctor. A lot of people will have a drink or two to a nightcap to settle in the evening, but it can worsen sleep quality, so that's something to just be mindful of. And then the effect of CBD and THC is unknown. It may have a negative impact on cognition, especially in older adults. And then, as I said, melatonin may be safe when used as needed, up to 3 milligrams. There is something called sleep hygiene, and so there are some classes in cognitive behavioral therapy that can help with chronic sleep problems. And so here in Algoma, the Seniors Mental Health Clinic or the Algoma Geriatric Clinic does have a group that meets to talk about that. So it's important to exercise your brain as well. So you're all exercising your brain by coming to this talk today. So that is great. So learning a new skill, attending a lecture, performing or watching music, theater, making art. So exercising your brain isn't just doing Sudoku or crossword puzzles. It can be just taking a class in person or online. Spending time outdoors is a nice way to stimulate your brain. In terms of games and puzzles and cognitive training, there's no specific program that has been proven to provide more benefit, but there have been studies done on different crossword puzzles, and sometimes there are some apps online that you can look at that can help. And then maintain your health. So regular checkups with a doctor or nurse practitioner are really important, which can be really challenging these days because a lot of people don't have a regular doctor. It's important to remember to have your eyes checked, to have good dental care, and to manage those chronic health conditions. And then use a walk-in clinic. There's more and more access to walk-in clinics in the community. And then of course, we're always advocating for access to primary care and improving our primary care here in Algoma. I just wanted to include, there is a study that just came out this year. It was published in the Journal of the American Medical Association, and it's very similar to a study that was done in Finland. So the Finland study was called the finger study. So the US study was called the pointer study. I don't know if they did that on purpose, but the US study is probably the most similar to our population because it's a North American population. So they looked at over 2,000 adults between ages 60 and 79 that were at risk for cognitive decline. And they compared 2 lifestyle interventions over 2 years. And those lifestyle interventions were all those things that we've talked about in this talk. So the first one was very structured. So they had structured meetings where they met together. They had a prescribed activity program that had aerobic exercise, resistance training, and stretching, adherence to that Mediterranean diet, cognitive training. So it was just sort of some similar online puzzles and games, social activities, and regular health monitoring. So all those things that we just talked about. And then there was an intervention that was self-guided that was kind of led by the person themselves, just had fewer meetings and were given the information, but it wasn't as structured. So the bottom line is that structured multi-domain intervention significantly reduced cognitive decline compared to a self-guided approach. So if you have the opportunity to be involved with a program that is more structured, whether it is through a specialty clinic, like the Algoma Geriatric Clinic, or your primary care provider, or through a retirement home or an association like the Finnish Rest Home, take advantage of it, because there's more and more evidence showing that this provides benefit and can delay cognitive decline and frailty. So healthy aging builds resilience. And so I'll talk a little bit about frailty. So you can tell I love flowers, I love gardening, so I have a lot of flower slides. So we'll talk a bit about resilience versus frailty. So we see the resilient daisy growing among the cobblestones, and then the flower that's sort of wilted. So what is frailty? Frailty is increased vulnerability. So it is age and chronic disease-associated decline in our physical reserve and function. And so it's that reduced ability to cope with stressors. And when I say stressors, a stressor can be something like a urinary tract infection, or it could be a major death in your family. So it's that physical stress and cognitive or emotional stress. So what do we know about older adults in Algoma? In our community, there are over 23% of our residents are over the age of 65, compared with only 16% province-wide. And now over the next 10 years, that is going to go up to 33. A third of Algoma residents will be over the age of 65. So that number is only increasing. And we are an older community compared with a lot of Ontario. 1 in 4, or 25% of these residents are living with frailty, which is a geriatric syndrome. So as a geriatrician, I'm always looking at geriatric syndromes and looking for geriatric syndromes. And what is that? A geriatric syndrome is a multifactorial condition prevalent in older adults. So it means that there's multiple factors that lead up to this that can lead to a syndrome of frailty. So it's a complex interplay of biological, social, and cognitive factors. So it involves cognition or mobility, social support, and medical conditions or medications that somebody has. So if you think about somebody who may require a wheelchair and has significant cognitive impairment, may live alone or has a few caregivers and has numerous medical conditions, that person is going to live with a lot more frailty than somebody who has maybe mild cognitive impairment and can walk on their own and has a large social network. So what causes frailty? And I won't go into this in depth, but it's kind of similar to what we talked about earlier with the science of aging. So it's these genetic factors and environmental factors that all combine to cause this molecular and cellular damage in the body. And that can lead to reduced reserve, physiologic reserve in all organ systems in the body. And all of that sort of adds up to result in this frailty syndrome. And so then when somebody living with that frailty ends up undergoing a stressor, like that urinary tract infection, for example, it can lead to a fall, or it can lead to confusion, and it can lead to the cycle of increasing disability, and ultimately increased care needs and admission to long-term care or death. So frailty reduces the ability to cope with stress. So just like I talked about that person who's managing well, let's say they're able to walk and attend activities in the community. They have a good social network. If they end up with a urinary tract infection, chances are they'll see their doctor, they'll have a minor setback, they'll be treated with antibiotics, and they'll kind of get back to their baseline. For that person who's living with frailty, who's very medically fragile, if they get that urinary tract infection, it can lead to this cascade of a fall. Maybe it could result in a hip fracture, which results in a prolonged hospitalization and ultimately dependence and death or severe disability. So frailty, I think of it as that Jenga analogy. So at a certain point, when too many deficits occur in the body, that structure kind of topples. It becomes more unstable. Frailty is associated with negative health outcomes. So we talked about the functional decline, hospitalization. For people that are in the hospital, they tend to have longer hospital stays. If they present with an illness, it can be an atypical disease presentation, and they're more likely to have postoperative complications if they do have to have a procedure. But the good news is that frailty can be prevented and modified. So frailty can be assessed through a comprehensive geriatric assessment, which is an interdisciplinary, individualized approach to care. So here in Algoma, we have the Algoma Geriatric Clinic, which is a clinic that I work in, where we can assess a person in a very holistic manner and look at ways that we can help improve their resilience. We know that exercise and physiotherapy are very helpful at preventing and improving frailty, a home occupational therapy assessment, and then review of medications, because often older adults are prescribed many medications that can kind of interact with each other and lead to more side effects and lead to more disability and more symptoms. So the Canadian frailty has a mnemonic called avoid frailty. So these are ways that we can prevent and mitigate frailty. So the number one is that the fountain of youth activity, so strength and balance training twice a week. Vaccinations, so making sure that you have your seasonal vaccinations. And there was actually just a study showing that the shingles vaccination is associated with decreased risk for dementia, which is pretty amazing. Optimizing medications through a healthcare provider or pharmacist review, including over-the-counter medications. And then interaction, so social relationships can build resilience. And then diet and nutrition, so balanced diet, vitamin D, and calcium. So I just included this slide because a couple years ago there was this documentary on Netflix about blue zones, which is where people are living with longer longevity and decreased frailty. But the bottom line is that these are all people that are just tend to exercise more, socialize more, well connected with their community, and eat healthy foods. So, I would take this with a grain of salt. I think that there are blue zones everywhere in every community, but the bottom line is these common themes have really emerged that to live longer and to live longer with better quality of life, sort of exercise, socialization, eating right, and having routine medical care are very important. So I just included this. Healthy aging begins at any age. So for people that are, for our children really, teaching them that physical activity is important, that it's important to have healthy social relationships. Everything that we're doing in our schools and at home can help them become healthy young adults and healthy middle-aged adults, which will help them be healthy older adults. So it really is a continuum. And you can start this at any age. Even if you were somebody who tended to be a couch potato in your 30s or 40s, you can start running, you can start being active when you are in your 50s and beyond, as long as it's okay with your doctor.
Thank you.
So that's it. So I just included the aging slinky as using the steroid. So thank you very much. And if you have any questions, I'm happy to take them.
Good job. Yay. Very good.